Okay.
Well, welcome everyone.
Oh, you're muted, Claire.
You've muted me again, Pam. Thank you. Right, I'll start again. Good afternoon, everyone. It's absolutely wonderful to see you. I hope you managed to get some downtime and a bit of quiet time during the holidays, even though the weather has just decided to turn up as we all go back to school. But I hope you did manage to get some rest and relaxation over the summer period. And we desperately tried to keep the communications to you at the barest of minimum in order that you could take that rest that you so desperately needed. Mike Gogarty hopefully will be joining us within the next sort of 20 minutes or so. Alex is not here, she's poorly at the moment, so it may be that we can't get round to all of your questions because I think we're all sort of getting to grips with the new world together collectively again, but myself and Mike will do our best to move things forward as much as possible. If we're unable to, then we will of course follow up from the webcast answers to questions as they come through, really, in that regard. I know there are colleagues from my team here, so I can see Jo, I can see Caroline, I think I saw Alison at some point. If I could ask colleagues, if you just keep an eye on the chat for me, just so that if there are questions we haven't quite got to, please do just sort of step in and remind me that there's questions we haven't quite answered with regard to everything. I hope the term has started well for you and in a positive way. I mean, we are sort of entering into a new period of change and a new period of managing to deal with things, but hopefully with the removal of the majority of the protective measures, it is starting to feel more normal for you. When Mike joins us, as and when Mike joins us, I will ask him to give you an overview of the epidemiology, just so you've got some context of where we are with infection rates within the county and sort of his view on the return of school children and further education into the system. But at the moment we feel pretty calm. Pam asked me last week how relaxed was Mike. I hadn't seen him up until that point. I did see him later on in the day and he was relaxed, and I take that as a positive point in terms of where we are. So that's not to say that you won't have positive cases, it's not to say that you won't have potentially outbreaks, but we will just respond to them as we have throughout in terms of an individual response to you and what that looks like. And I think the mantra from the government now is that education remains an absolute significant priority, and that we have started the academic year with schools returning to normal as much as possible, whilst operating still within the environment of the pandemic and operating with the environment of the infection still being in our communities. But the prioritisation now is really to return to normal and to prioritise children and young people's education. So that really is the mantra from the DfE, and that's what's behind all of the guidance going forward. We are in the process, sorry, they're taking me a little bit longer than I'd hoped, of writing an open letter to parents to share with you that would be co-signed by Mike and myself. And if you want to use it, and it is a genuine, if you want to use it, an updated letter around the what to do communication to parents about what you're doing if you have a positive case in your school. They are taking slightly longer because of the complexities around self-isolation and contact tracing, and just making sure the messaging is very clear. And the more I read it and the more I get into the writing the letter, the more confusing it could be if you get the messaging a bit wrong, really. So so that's where we've got to. So if I start off with an overview, then we'll pause when Mike joins and maybe hand over to him for the epidemiology, and then think about going through the questions, whatever comes through in the chat as we start. So obviously the obvious is you don't need to operate any of the protective measures around keeping children in groups, keeping the groups separate, the bubble management that you were all doing. Children can come together in large groups, assemblies can return, all kinds of wider curriculum areas that you may have reduced or suspended can return as well with regard to returning to normal. Protective measures that do need to continue are around cleaning, but just as you were doing last year, no more than that, ventilation, and just remaining vigilant really with regard to the protective measures around all of that, which you're well versed in terms of where we go. And then really it's just around the advice on testing, self-isolation and managing confirmed cases. And I think that's the bit that's the least clear in all of that. The work that you're doing on all the others remains as is. So that's sort of one of the key changes. I can see that Mike has joined us, but I'm going to carry on, Mike, if that's okay, and bring you in a moment. So perhaps once I bring Mike in, then we'll go on to the contact tracing arrangements, the what to do if you have a positive case coming through from an LFD household test in your case, and obviously twice weekly testing of secondary age pupils is still a feature of the system for secondary schools moving forward. And then how that links in with the confirmatory PCR test. Requirements around self-isolation if you're identified as a close contact, those are the areas that we're just sort of really working through in terms of the detail, and that's what I'm trying to clarify in the letters for you, and we'll talk them through, and some of those were in the questions that came about. But Mike, if I can bring you in now, thank you. It would be really helpful if you could start with the epidemiology, Mike.
Okay, thank you. So thank you all, and apologies for a little bit late. We still have some outbreaks to deal with, which I have to deal with. So broadly speaking, the rate in Essex is in the low mid 200s, which is actually twice the rate it was when we went into higher tier last year. But actually, it's not such a deal because it's not translating into hospital admissions. The rate in Essex is the lowest in the east of England, where the average is about 270, 280. The regional average is about 300. So Essex at the moment are doing relatively well. All places in Essex are kind of much of a muchness really. There is some variation, but broadly, all areas are sort of within the 200s, a few in the high hundreds. In terms of the age range, the important thing is we're not seeing a particular increase in the over 60s, who are the ones who will be ill, will end up in hospital. And the rates of hospital admission are pretty stable. They've decreased very, very slightly, but the reality is they're probably pretty stable. There are about 138 people in hospital with COVID, not because of COVID, with COVID across Essex at the moment. To put that into perspective, in January there were 1,400, so and they were mainly with COVID. So the rates are quite are manageable, and that shows that there's been largely a disconnection between infection rates in the community and infection rates in hospital due to the vaccination, which is hugely successful in preventing admissions. Much less effective in preventing spread and less effective in preventing illness, but much more effective in preventing serious illness, hospitalization and death. In terms of age-specific rates, the other areas to note are that we've seen a big decrease in the 19 to 22-year-olds who were actually driving a lot of the cases previously. That's probably due to holidays, festivals, sports events, but actually the rate in that group has dropped quite dramatically. Conversely, as you would expect, we're already starting to see a rise in the rates in secondary school children, not primary, but secondary school children. And the increases we're likely to see in Essex, which we will see over coming days, although modest, will be driven by secondary school children. And we don't know whether that's going to go up considerably or just a little bit, but it partly is because they've been looking for it. People, secondary school children have been having twice weekly testing, and that has turned up asymptomatic cases that wouldn't otherwise have been identified, I guess. I'm going to be asked tomorrow on the radio whether or not I think there's going to be a circuit break lockdown in October, and at the moment I can't see any reason there would be. I just, unless rates go very, very high, which I'm not seeing at the moment, I don't think that's something that's going to happen over half term. So I can't see us going back to a lockdown in that way, and particularly if the hospital admission rates aren't going up. The next issues are around vaccination. So those who are very, very vulnerable in the sense that they're extraordinarily immunosuppressed and the 2 doses of vaccine isn't enough are now being offered a 3rd dose of vaccine as part of their primary course. Work is going on to start to roll out booster vaccines for those who had the vaccine first and those who are most frail and most at risk. And as you know, the JCVI ruling or decision was that there is no clinical medical evidence for a benefit for offering 12 to 15-year-olds a vaccine regime. However, there is still consideration from the CMOs and others and Department for Education about whether or not there is a benefit in terms of helping those children to stay in education. So that's kind of where we are in a nutshell. It's difficult to say what's going to happen going forward. I think cases will rise because of what's happening in schools, in secondary schools. But I think we'd be unlucky if that translates into big increases in the older population and therefore hospital admissions. I'll stop there. Thank you. Happy to take the question.
Thank you, Mike. I can't see any questions that have come in about that, but there may well be. So let me try and link things up now. Mike, please do chip in here. I need you to help me out with a double act here. But in terms of then what to do around positive cases and how that will affect your school going forward. I mean, the first thing is with regard to secondary schools, as Mike said, you know, the 2 tests before they start, we are looking for asymptomatic, we're looking for young people that have got the virus, and therefore that's why that's coming through. That testing regime doesn't feed into the thresholds for the contingency framework. So the contingency framework is only something we would consider when we are more settled within schools, and there is the threshold that will be to be met, really. So I'll come on to that, and Mike and I can come on to the contingency framework in a moment. So if you do have a child who's symptomatic, it's exactly the same as it was before. You need to send them home and they need to get a PCR test to determine whether they've got coronavirus or not. If you have a child, because they're testing under the household testing regime and they test positive under the lateral flow test, and this is the bit in the parent letter I'm trying to make sure is very clear, then they will be contacted, then obviously they will submit their results and they will be advised to get a PCR test within 2 days of the positive lateral flow test result. The children and adults do not need to self-isolate, but children particularly do not need to self-isolate whilst they're waiting for the outcome of the confirmatory PCR test. And I've checked the guidance out about that again. Obviously, if the confirmatory PCR test is positive, then they need to self-isolate immediately and follow all the rules around self-isolation, and they will be advised by NHS Test and Trace, who will then do the contact tracing with regard to that. And then if the PCR test tests negative, obviously they can continue as normal, really, in terms of where they go. The same is true of your staff. So except the difference being around the vaccination rules around self-isolation. So if a member of your staff, obviously if they test positive, they need to self-isolate, they need to get the PCR confirmatory test and then self-isolate if that's positive. If it's negative and the PCR test was done within 2 days of the lateral flow test, positive and is negative, I hope that made sense, I'll say that again. If they're positive on the lateral flow test and then within 48 hours have a confirmatory PCR test which is negative, then they can return. If it's longer than 2 days, 48 hours, then Test and Trace will advise on that with regard to the test. Obviously, if it's positive, they need to self-isolate. They don't need to self-isolate during that period if they've got the full 2 doses of the vaccination, and they don't need to self-isolate if they are a close contact if they have the full dosage of the vaccination. So that's where we're getting into sort of it being quite difficult. If a member of staff, either through work or through going about their daily lives, is identified as a close contact through NHS test and trace, depending on who in their community has tested positive, and they haven't had the vaccine, then if they are identified as a close contact by NHS test and trace, then the legal obligation to self-isolate will kick in. And then we get into all the questions around who in your school's been vaccinated and who hasn't. So the advice that we've got from Juniper is that you can't, well, you can ask your staff to voluntarily tell you if they have been vaccinated, and should they wish to give you that information, then they're able to do that, and you can very much do that on a voluntary basis. What you can't do is insist that people share with you the status of whether they decided to get vaccinated or not. Of course, if they are contacted by NHS test and trace and are identified as a close contact and therefore required to self-isolate under the legal duty, then they will have a legal duty to inform you that they're now requiring to self-isolate, and you will need to manage that. Now, at the moment, you know, we're expecting there to be understanding and empathy around that. But of course, Juniper can advise if you have a member of staff who spends a lot of time absent, if they are, you know, a close contact, identified as a close contact on numerous occasions.
Claire, sorry to interrupt, just to let you know, Nikki is here, Nikki Harris,
oh,
so
great.
If you need her to jump in or...
Fantastic, yeah, thanks. Jump in, Nikki, if you need to. Of course, one way to prevent your staff still being a close contact is to minimise the contact they have with other adults and children, but that doesn't need to happen now. But that's the trade-off between those who haven't been vaccinated, really, around that. So I appreciate that's a dynamic that you haven't dealt with in the past, but it is a feature of the system at the moment if people have chosen not to get the 2 doses of the vaccination. If they have and they're a close contact, they don't need to self-isolate unless they become symptomatic, and then obviously you're into the symptomatic part of the system in terms of how to deal with that. I saw one of the first questions that came through on the chat was around informing parents of a positive case, and we've thought long and hard about this, Darren, in terms of what to do. I think that we are drafting a model letter. I think a number of thoughts have gone through my mind in the drafting of it. The first is it's entirely up to you whether you want to use it or not. That would be the first thing. If it's all calm and settled in your school and you don't think there will be any close contacts, then I think the question is, what is the purpose of the letter? And indeed, Darren, I think that's your case, as the adult didn't identify any of the children as close contacts. And so, you know, I don't think you do need to worry about informing that. The thrust of the letter is to inform parents, potentially if they are then contacted, if their child is identified as a close contact, and what parents then need to do if their child could be a close contact. So the other thoughts I've had around the letter is you might want to share it just with parents of the class where the child is the positive case, just in case NHS test and trace does get in touch, and then there's a letter around that. So I'm probably advocating that I'm not sure you do need to do this whole school approach that we used to have before, but you might want to think about who potentially might be a close contact, and it's a sort of a heads up alert to parents of what to do if they are contacted by NHS test and trace as their child has been identified as a close contact. So that's really the thrust around the letter. But again, if that's not working for you, when you see it, come back and let us know with regard to that. So I'm just reading Sam's question. So if a child's parent or sibling tests positive, should the child have a PCR test before returning to school? So when Test and Trace phone up the family of the parent or sibling who's tested positive, correct me if this is wrong, Mike, they will probably advise all members of the household to get a PCR test. The guidance at the moment is that if you are a close contact and you're under the age of 18 and 6 months, or you have been double vaccinated, as a close contact, you do not need to self-isolate whilst you're waiting for a confirmatory PCR test. I'll bring Mike in a moment on this, if that's okay, Mike, because you and I have talked about this. Only then, if the PCR test is positive, do they then need to self-isolate. Obviously, if you're not vaccinated as an adult, then obviously you do need to self-isolate. And you can only be released from your self-isolation if the PCR test is negative and is done within 48 hours. So at the moment, the government are going for maximum school attendance. Okay, so they are saying that if it is a close contact, they are advised to get the PCR test pretty quickly, but they do not need to self-isolate until the results of that test come back. Or if when they're waiting for the test results to come back, the child becomes symptomatic. And that's the challenge in the comms, really, in terms of that. So it's either don't need to self-isolate unless you become symptomatic whilst you're waiting for the results to come back, or you then test positive from the PCR tests. And that's the situation.
Sorry, one problem, and I guess this happens occasionally, is that I've certainly heard that some head teachers have had contradictory advice, for example, from 119. So one head teacher reported to me that a child's symptoms had started on a Friday, lateral flow test done the next day, sister tested positive. When mum called 119, she was advised that they shouldn't get PCRs but to isolate. So that obviously directly contradicts the guidance that we're all going by. And I think Nick has mentioned in the chat, and I think I've mentioned before, that I think a flow chart would be lovely, not least for schools, but also for parents, so that they understand the process, if that's doable. It will maybe very complicated.
Yes, no, I'm happy to. I mean, I'm sitting on the letter, to be honest with you, because I would like to get it right rather than rush it and get it out. So it doesn't have a flow chart at the moment, but if you can bear with me, we'll try and do that. I'd rather get the right messaging out and it be slightly delayed and get criticised for that than send something out and get the wrong message. That's not the first time I've heard that, Pam, about incorrect advice from 119. So Mike, I don't know whether we can pick that up either through Gemma or whatever, because there does seem to be confusion about the advice coming through, Mike.
Yeah, but it is confusing. So I'm looking down the questions. So we're talking about which one now? Which particular question? Because there's a couple which have different answers, I think.
So I think what's confusing, so I've just been talking about children who are close contacts. So that's the first thing. The next set of questions I think picking up are where a child tests positive for an LFD.
Yes, that's right.
They then need to self-isolate until the confirmatory PCR.
That is correct. So the close contact does not have to self-isolate while they are waiting the PCR test result. The positive LFD does have to self-isolate while they're expecting the PCR result. So that's Nick's question.
Yeah.
Okay, good. Yes, that's right. Does that make sense to people?
I think it's what I've been trying to sort of get clear in my mind is you've got people who test positive or are symptomatic. And if you test positive or are symptomatic, then you need to self-isolate, get the confirmatory PCR test. And if that's positive, obviously complete your self-isolation period. Only if the PCR test is negative, particularly if you've tested positive on an LFD, but even if you're symptomatic, can you then be released from the legal obligation to self-isolate?
Correct.
That's symptoms or positive tests. You've then got the close contacts, which if you are double vaccinated or under the age of 18 and 6 months, you do not need to self-isolate, but you are advised to get a PCR test because you've been identified as a close contact. You do not need to self-isolate whilst waiting for the outcome of the PCR test, unless you, as an adult, do not have the vaccine. You only then need to self-isolate if your PCR then is positive, or you become symptomatic whilst waiting. So that might be helpful to put that in a flow chart. One is about symptoms and positive test, asymptomatic and symptoms positivity, and the other one is close contacts, and then potentially risk of being positive as a result of being a close contact.
Claire, can I jump in here? Sorry to just butt into the meeting, but I guess it's my role as one of the chairs of EPHA. I think, you know, we've got 179 participants online here, all fairly intelligent people who are struggling around with this. So I think it does need to be very, very clear, because of course I've got a community of 422 children, so over 1,000 grown-ups that you're trying to explain this to us now, and it's taken 25 minutes. Doing that on a mass scale, which is what we're doing currently at the moment with staff and children, is why we're coming undone so quickly in the first few days. And I appreciate you're trying to do your best, but it is about this flowchart element and the nuance between I've got a positive test result versus I've got nothing but I'm a close contact, plus I'm under the age of 18, or I'm double jabbed or not. And then the ridiculous notion that you can't actually ask a member of staff if they're double jabbed or not. So I think you're trying to explain it to us, and I guess I'm just trying to put back to you the enormity of the task when you're doing it, and you're doing a fab job. Honestly, you are, but it's taken 27 minutes so far, and we can't repeat that with 400 odd families. So that's
I know, and you know, it's one thing me saying I'll write you an open letter to parents, and another thing me rereading the paragraphs going, these don't make any sense whatsoever, and I'm just going to confuse the whole parent population, Nick. So it is hugely confusing. I'm happy to admit even I'm sort of struggling with A, what it all means, and B, how do you communicate it in a way that is understandable, and I think that's the complexity of it. Leave it with me, Nick. As I say, there is an open letter coming from Mike and myself. We will attach a flowchart to make it easier, and you can then work that through with your parents who are also confused. I mean, it is all new anyway, so you know, we just have to bear with at this moment in time, but we'll just have to do the very best we can. But the more we get into the devil in the detail, the more confusing it actually is, to be honest with you. It's one of those muddy areas that just gets more complex rather than gets, once you get into it, it seems to clarify itself. So we'll do our very best, but I might use you as temperature checks just to see if it makes sense before things go out as well, with regard to that. So
could you and Mike just give an overview or an explanation of what an outbreak is? And because again, the DfE guidance seems, or certainly former guidance, said it was 2 cases, in which case we probably got an outbreak in most schools. So I gather that's not the numbers that we're going on, but could that be explained? That'd be very helpful.
Do you want me to have a go?
yes, please, Mike.
Yeah, so they're not called outbreaks anymore, because you would expect to have a number of children with infections within the schools. So what they're now defining is thresholds, which they're defining as 5 children, pupils, students or staff who are likely to have mixed closely, who test positive in a 10-day period, or 10% of children, pupils and students and staff who are likely to have mixed closely, test positive within a 10-day period. But so basically, it's for most schools, it's going to be 5 children, pupils or staff within this 10-day period. And if you do that, if you have that, then there's an expectation that you would seek support from the local contact tracing service around it. Although actually the ability of the contact tracing service to actually get to do much is fairly limited. My sense is that the expectation from the Department for Education, also the Department for Health, is that we'll take a very light touch to this. This is partly on the basis that the studies in secondary school children, who are much more infectious than primary school children, showed that considerably less than 1 in 50 contacts were infected from a given case in secondary schools. So cutting to the chase, it's 5 within 10 days.
So just to be really, really clear, someone's asked a question, and you said 5 children or pupils, or 10% of pupils?
Not children, all staff.
Or so across the whole school population, not just a year group, the whole school population.
It's 5 who are likely to have been in contact with each other. So that will vary from school to school, isn't it? And vary from situation to situation.
Yes, it will vary a lot.
So there is a judgment call required from you guys about whether or not you would say that they've mixed, are likely to have mixed closely.
Okay.
So it's 5 children who are likely to, or students, staff who are likely to have mixed closely, test positive within 10 days.
It's good and vague, isn't it?
So, and then Mike, Kelly's asked about, is that working days? So I think what it's about.
No, it'll be 10 days. It'll be
10 days, yeah.
The COVID doesn't have the weekend off.
Yeah. But it's trying to work out whether there is whether there is infection transmission happening within the school environment. Is that right, Mike? That's what we're trying to look at.
Well, that's right, because a lot of the infections will be, in the community, and they make that irrelevant. Yeah. They have to be associated with each other to raise concern that this may be spread within the school. Yeah.
So the likelihood is, there's questions and then into the detail of that really, but I think the plan is with test and trace that then there would be, particularly within the early days, would be an incident management team meeting with you, and that will be colleagues from the public health team, the contact tracing service, and my team, and then we will talk through what further protective measures may to be considered as a result of dealing with potential transmission within the school community environment. That's correct, Mike, isn't it?
Yes.
Yeah, so some of the questions about what do we then do, I'm kind of saying actually we can't give you those answers, because A, it would be individual and bespoke to your school, and B, it would be done through calling an IMT meeting, as we have done throughout the pandemic. Okay, very helpfully I noticed that Kate's offered to share a flow chart that she's got, so I would really appreciate it, Kate, if you could email that to me. And I know Mark's on the way. Confess that he's got it. Thank you very much, Kate. Really appreciate it. We'll get that out. I will try and get things out to you as soon as possible, but also I'd like to make sure it's as clear as possible. Otherwise, we'll just delay just by having to update it again. Really. Okay. I'm just checking that we've.
Nick's put it in the chat, Claire.
Thank you.
So it's one that I stole from a head teachers group on Twitter, just to attach something really clear for parents to follow. When do you need to isolate, when do you not? And I think it's a Word document, so people can phrase it as they want for their community.
Great. Okay, that's really helpful. Thank you very much, Kate.
It's there for people to use.
Great. Okay, well, it probably look like that, so just bear with me when it comes out to you, really. Okay. So I think that we have spent a lot of time on that, but that's where I think the most confusion is coming in around everything. Okay, so I'm going back to the questions that came in advance. So I think we've done around the testing and the close contacts. There are a few questions in here, Mike, around around the test and trace, the NHS test and trace. I don't know how we escalate them up, Mike. What's the process to do that? So
you just call the Essex contact tracing service if you have concerns. Okay. So if you're concerned about any of the advice, then just do that. Michelle, who organises the IMT? It's the local public health team, so it's Mike's team basically that organises the IMT in partnership with my team and Essex Contact Tracing Service. Well, I mean, to be honest with you, I think probably the contact tracing service will be giving advice in most cases rather than us escalating everything to incident management teams, because I think there'll be loads and loads, to be honest. I don't think that. Yeah. And just to confirm, I'm sure this is the case, but if new guidance comes out to schools or clarification, presumably that's shared with Essex Test and Trace as well, so that they can see what information has been shared with schools. Is that right?
They're on the distribution list, Pam. Yeah.
Oh, brilliant. Okay.
Yeah. And I think Gemma would want me to say that her team are there for advice, the way you've been using them before. So, you know, don't hesitate, and you have already. Just give them a call if you need to, and they'll be able to help you and answer any queries that you may have. So please do use them and sort of get used to this new way of working, really.
And it will be really bumpy and clunky because it's complicated, and I think everyone just has to be tolerant of each other as much as possible as we sort of fumble our way through it, really.
Yeah, I think one of the questions we haven't answered that seems to be coming through, I mean, the test and trace will do the contact tracing. So I think there was a bit about how far does that go. They will do the contact tracing. They will work with the family, they will work with the child, and they will do the contact tracing and identify the close contacts. So don't need to worry yourself about that. They may
can I just interrupt? Sorry, contact track, whatever they're called, they contacted me as a close contact because the parents were asked to name the school.
Right.
So I'm going to send something out to my parents saying, please make sure that when you're giving the name of the school, you don't include me as a close contact, because otherwise I'm going to spend my whole life being invited to isolate for 10 days. You know, lovely, but not terribly practical.
Yeah.
Well, as long as you're vaccinated, you'll be all right.
Yeah. You're fine if you're double vaccinated, Kate.
Oh no, I was thinking I was just going to have multiple blocks of 10 days at home.
You're okay. There are a number of questions about is it a requirement to get a PCR test if you are identified as a close contact? I'm going to let Mike answer this. I do know the answer, but Mike, would you be able to answer that question?
So in small numbers of close contacts, yes, but it will depend on, you know, certainly. So yes, the short answer is yes. The longer answer is you probably wouldn't do it for whole schools unless it was absolutely, you know, so it would have to be a small close contact group, but yes.
Yeah, but it can't be enforced, can it, Mike? I think was behind the question.
Oh, no.
Yeah, it's advisory. Okay. Right. Okay. Matt, you come back again. So let me just digest your question.
Do you want to jump in, Matt, just so people know what the question is?
It's basically about larger groups, isn't it? Really hosting things face to face.
Yeah, hi, yeah, basically about events. So there's kind of two types of events I can see. One is kind of where you might have parents in smaller groups. In our case, a briefing about a residential that would be better done face to face, but could be done virtually. So what would you recommend with that at this point? And then what are the implications of doing it face to face? And then, like lots of schools, we're trying to kind of plan for a bit of normality and be optimistic and thinking about kind of diary dates for the year ahead. What are your thoughts on things like harvest festivals, given that I can go and watch West Ham with 60,000 other people? What's the thinking with that? Thanks.
So West Ham are doing really well, but aside from that, I think that so I think we are going back to normality. I think that there are so many other opportunities for infection there. What I would do is I would suggest and request and strongly advise that parents have lateral flow tests before they visit the school to protect everybody. But other than that, I think we need to get back to normal. So I would have both the face-to-face things if required, and also to have the Harvest Festival, etc., as required.
Thanks, Mike. I mean, the reason for my asking was that's kind of my gut, but I'm sure like everybody else, we spend a lot of time kind of on Facebook groups or Twitter and so on, and it's really quite polarised, not just in Essex, but up and down the country in terms of what the views of school leaders are about this. And I guess we're all sort of captains of our own ship, but thanks for that. It's just kind of nice to hear it, so I've got a bit of confidence to proceed with that. I'm sure people have different views, but thank you.
I think the bottom line for me is what's happening in the hospitals. And as long as we're not seeing cases rise in the hospital, we're not seeing serious illness, then we just have to learn to live with this thing and get on with it. And I think the move back to normality as much as possible would make sense. So,
for example, if I'm going to have 30 parents sitting in the hall, would you be advising that we socially distance them if we can and find a halfway?
If you can, yes, but if you can't, don't worry. But yeah, social distancing remains sensible. But actually, as you say, they're probably sitting in West Ham and elsewhere. I was in Wembley the other day, expected to be checked and wasn't checked at all in terms of my vaccination status. So, you know, I think we just need to get back to normal, but suggest they do a lateral flow test. That'll weed out some of them.
Thanks very much. Up the others.
Yeah. I mean, I would use all of these opportunities to continue to push for the twice weekly testing, very much to continue to remind everybody to do twice weekly testing. It is part of living with the disease. There was a question a few minutes ago, I think I've seen it twice now, about asking visitors to do for a negative lateral flow test before coming to school. I mean, I'm not sure you could ask for evidence of it, but you know, I think you could encourage it within your visitor policy with regard to that. And you know, ultimately, if you're going to take a lateral flow test and it's positive, I wouldn't assume somebody would turn up, to be honest with you. So you know, I think just encouraging as much as possible the regular lateral flow testing. And if you are bringing parents in, as Mike said, for specific events, try to encourage one very near to the event going forward, or socially distance if you're able to, with regard to that. You know, that is a feature of life, and it's not, you're not being unreasonable. Many other places will continue to do that as well.
And you're protecting each other, your family protecting each other. So I think most will rise to it. It's a pain, and you worry it's going to be positive all the time, but you know, I think that is going to be part of the new normal.
Yeah.
There are a few questions around staff, so pregnant and critically vulnerable staff around risk assessments and so on.
So the advice around those who are pregnant and over 28 weeks in the third trimester, it has not changed. I've got Nikki here as well. She's popped up on my screen. Thanks, Nikki. And we have checked this out with the DFE and so on and so forth. So I'll let Nikki explain, so you get it absolutely 100% accurate from her.
Yeah, so the position is, as it has been throughout, is that wherever possible, pregnant ladies over 28 weeks should work from home. They can come in if they want to, and you've got a risk assessment in place and it's supported by their medical practitioners. So they're not prevented from coming in, but neither should they be forced to come in unless, you know, the risk assessment is absolutely robust, including social distancing, which is considered to be the best prevention measure for them. But the general message for 28 weeks remains that they should work at home and not be required to attend. Obviously, it depends on the role. Some roles you may be able to make other adjustments that means they're not mixing closely with other people. We've checked it out with the DFE over and over again, and we keep getting the same message back. There's no change on that. CEV, yes, there should still be individual risk assessments in place. So you should be reviewing and updating your individual risk assessments in respect of those CEV people. Most of them should be back at work. Most of them should, or where possible, have been vaccinated, which will add additional support to the protective measures that are in place for them. So it's just about revisiting and updating the risk assessments that you've got in place for them.
Thank you, Nikki. Okay.
It's gone all quiet.
We're all reading the chat like mad. So there was a fairly specific question, but about use of common or water fountains in playgrounds, whether they're okay again now, or what your advice is around equipment and so on.
Again, I think in primary schools, children are not likely to be infectious, and that's not, the water shooting out of it's not going to be a high risk of infection, so I'd be happy for them to be used.
Yeah, that links into one of the questions that came through, Pam, ahead of the webcast around still sticking to some of the arrangements around a cautious attitude and what we're doing. I think, you know, the advice is that the restrictions bar those that are in the guidance around hygiene, cleaning, ventilation, you know, have been removed basically. If things worked well in your school and actually logistically and operationally worked very well, and there's a clear rationale to continue with them, then again, that's your decision, and your risk assessment can help with that. Obviously, you'll need to explain why you're doing that with your parents with regard to that. But you know, again, if you decide to do that and there's a clear rationale for that, then we would support that. If that's your decision, but they're not needed, I think is the point that's being made. And you know, and schools can return to normal in terms of assemblies, choirs, and all of that as well, moving forward. So, you know, I think that it is a question of your risk assessment determining that. It's not required, but if you have other logistical and operational benefits from doing some of these things, and it's easing the flow of the school day and the flow of the school life, and it's really helped, then yes, of course, if you want to continue with it, do. And as long as that's understood by your parent community, we'll happily support that if you do get any criticism around that.
I think my position on this would be that go ahead with it, and then if you end up with your 5 cases and you're over that threshold and you talk to the Essex contact tracing service and we need to think of additional things to do, we may row back on that at that point and say, look, stop looking at the fountains for now, let's have some extra cleaning and that, but generally we would not do that unless there was a specific need in your school to do so.
Thanks, Mike. Okay, there was one particular question around the CO2 monitors, which I have already passed up to the Department for Education on the questioner's behalf with regard to that. So I think we're waiting further information about the CO2 monitors, and I think we're also waiting further information on any news around the pilot around air purification, whatever they're called. Air purifiers.
I must admit, I'm not a great fan on the CO2 monitor thing, because you can still have the virus with low or high levels of CO2. So it's not one that I'm actually, mega impressed by.
And certainly one of the concerns that I've heard from head teachers is, so what do you do if your CO2 monitor says that the air quality is poor and you've opened the door? Quite what you can do about it then, because I'm pretty certain the DFE won't be following up with additional funding. So yeah, hopefully it will be a brilliant wheeze that comes and goes, but we'll see.
Yeah, that would be my view.
Wheeze is probably the wrong word actually, but anyway.
If you've got the time and energy, phone the DFE up and ask them the question, see what they say.
Yeah.
It'd be interesting to see that response really come through.
Good luck with getting through, everyone.
Okay, so there's a follow-up. I'll let Mike answer this one whilst I'm reading Kathy's question. Mike, crystal ball gazing for any future lockdowns in your view?
So it is really, really hard to call this at the moment, but if you push me hard enough, I would say no more lockdowns. With the caveat, as long as there isn't another variant that kind of ducks the vaccine.
Right, so there's an interesting question from Kathy. Can a parent who's tested positive on PCR but has no symptoms bring a child to school as essential journey if no one else available? Could drop off 5 minutes early and pick up 5 minutes later than others? So I think I'll give this a go and Mike can come in. So first and foremost, obviously the child is likely to be identified as a close contact and therefore required to get a PCR test. So you're talking about the time between the parent testing positive and the child having a PCR test as a close contact. I think in terms of your working with parents, my suggestion is that parent doesn't leave the car because they are required to self-isolate. They probably are on the very lateral definition of self-isolation by taking their child to school, but I can get that because that's equally important, but they really can't mix at all with anybody else. So it is about perhaps putting a bit more around them to make sure the parent doesn't mix with anybody else. Mike, would you add anything to that?
No, I would agree with that. I think if you were a draconian, you say they couldn't do it, but practically you could. I think the reality is, well, particularly people being double vaccinated, the person knows that the person who happens to have tested positive PCR and has got no symptoms. There are a hell of a lot of people out there who haven't had a PCR and haven't got symptoms and positive as well. So, from a public health point of view, it's not a biggie. I think that what Claire said is spot on, really.
Right. Okay. Thank you.
And certainly I've had some questions around attendance codings, for example, and I know the codings are clear around if a child is ill, there's one coding, if a child is having to isolate, there's another. But I was asked a question around if people are keeping their, are keeping their child away from school because they are ill and can't get their child to school, what the school should be coding that as. I have to say, my feeling was that's really no different from any situation that a parent finds themselves in when they're ill and can't get their child to school. So being perhaps a little bit harsh, but saying, well, actually they need to work out how to get their child to school. But I don't know if there's any whether that's absolutely right or whether there's any different coding, for example, for that. I think we are certainly seeing some parents who are just erring on the side of caution. And as Claire knows, I asked her to include in the letter a comment about that unless a child is having to stay at home for COVID-related reasons, positive or isolating, you won't be providing remote education, for example, so that we're not encouraging parents just to keep their children at home.
Yeah, and I think this is where we're into the really murky world, and I think, Amanda, you sum that up in your question, really. I think, unfortunately, as you have done all the way through, but brilliantly nonetheless, it is a judgment call. So once we get the open letter to parents sort of right, it will say attendance is mandatory. And therefore, I agree with you, Pam, you know, parents can be ill for all kinds of reasons, not just COVID, and not be able to get their child to school, and you would still expect them to make alternative arrangements to get their child to school, whether that be other members of the family, friends or whatever, during their period of not being able to leave the house due to being unwell. So I think in that instance, you would still probably want to work with the family about what other alternative arrangements they could put in place to get their children to school whilst they're too ill to do that themselves. Amanda's question is interesting around a parent requiring in law to self-isolate.
The same, isn't it?
Being unable to bring their child to school.
The answer is the same, Claire.
It is the same. Technically, they have a legal duty to get their child to school. Their child doesn't need to self-isolate. Their child does need to, no, if they're a contact, then they don't need to self-isolate. If another child's tested positive, then they may be waiting for a confirmatory PCR test, but they still are required to attend school. We do expect that period between the sibling being positive and the waiting for the household to be tested through the PCR test. There may well be a small dip in attendance there. It's a difficult one. Technically, you would unauthorise it. But you know your parent community, you know what to do, and I think that's a judgment call around coding there in that particular instance. But the official message is, unless a child is positive or symptomatic, they are in school.
Excellent. Seems to be a good sentence to finish on. Are there any further questions from people? Claire, Mike, if it's all right with you, I think we would welcome another webcast in a few weeks' time, just to sort of check in with yourselves, if that's all right. Obviously, still lots of people are attending these, and we certainly, it's been really, really helpful today. Are there any final questions from people?
Sorry, Pam, we've just, it's Nikki, we've just had a query today about a school that, as part of its risk assessment, is requiring people to wear masks, and somebody is objecting to wearing a mask. Now, I think I'm clear on the position is that masks are not required generally. Is that right?
Yes.
It is right, yeah. And DfE guidance actually even says it's not advised, which is an interesting word to use. So whether that could be interpreted by staff as schools aren't meant to be using them. I don't think that's what the DfE guidance means. I think they should have said required, but certainly some staff will read that, I think.
Okay, thanks.
So I think Nikki, again, with everything, you know, I think we would question the rationale behind the sort of the blanket requirement to wear a face covering, because it is not needed. Of course, I think as we all go about our lives, if you want to wear a face covering and it's not impeding your ability to do your job, then that's a discussion that needs to happen, doesn't it, really? But that needs to come from the individual to the school, not the other way around, Nikki.
Yeah, thank you.
Yeah. Okay. Glenn, I've got your question around updated template for CV staff. Is that something, Nikki, you can take forward? Or is that an R template? Risk assessment.
Nikki, you're muted.
Sorry. Yes, an updated risk assessment was sent out with the FAQs. So I'll get it sent out through the comms again.
Okay, we'll put the FAQs out again. I know you were probably busy at the beginning of term digesting everything. So we'll get those sent out again next Monday. So if you didn't pick them up, on info link, but if you didn't pick them up, we'll send them out again. Okay, great. Thanks, Alison. Same question, so we'll pick that up. Great. Thank you very much indeed. Thank you very much, Harriet, Pam, Nick, for pulling all of this together. I think the question was, we're very happy to continue this. As we say, we're in a new world again, and we just need to work our way through this. But hopefully, as usual, Mike, thank you very much, because I think you give very reassuring messages that, you know, just got to get on and do it now, really, and be as pragmatic as possible. We will do our very best with the flow diagram and the information about close contacts on the one hand and symptomatic and positive testing on the other hand, and trying to get it as clear as possible. But thank you very much. It's lovely to see you. Have a good rest of the week. Thankfully for you, the weather is breaking, I hear, on Thursday, so you're not having the irony of being back and it being glorious sunshine. So it's only a few days, and no doubt we'll touch base over the next few weeks and into the course of the term as well. But welcome back. It's wonderful to see you. You're all looking very well and very healthy, and that's lovely as well. So take care. We're here if you need us. Just go through school comms. Anything that you need, let us know. Likewise, I know when I say that for Gemma and the Essex contact tracing team, anything you need, they'll be happy to answer that as well. So thank you. Good luck, everyone.
Thank you.